Today we are going to demonstrate knee control training exercises for a right side hemiplegic patient. So the first technique is hip and knee flexion over the side of the bed. For that, the patient's position is supine lying with leg outside the couch, and the therapist position will be at the foot of the patient. Ask the patient to clasp her hand and place it over the head. Now place the patient's leg over the side of the bed with her hip extended and hold her knee in flexion and foot in full dorsiflexion. Maintain the position of the foot and ask the patient to actively perform hip and knee flexion. The next technique is knee extension with dorsiflexion. The patient position is supine lying with the affected knee flexed, and the therapist position will be at the foot of the patient. The affected foot is held in dorsiflexion and the patient's leg is moved from full flexion into extension without her toes pushing down and without the rotation at the hip. The next technique is bridging. In this, the therapist's position will be at the side of the patient and the patient's position will be in crook lying. Ask the patient to clasp the hand and place it over the head. The therapist has to make sure that the patient's foot is maintained in dorsiflexion. One hand will be at the foot and the other hand will be supporting the affected knee. By putting weight on the affected side, the patient has to try to lift the hip and maintain this position for a few seconds as tolerated by the patient, and then slowly take the hip down. The next technique is knee extension with ankle dorsiflexion. For this, the patient will be sitting on a chair and the therapist will be at the side of the patient. First, ask the patient to actively dorsiflex and then extend the knee and maintain this position for a few seconds or as tolerated by the patient, and then slowly take the knee down. The next technique is sit to stand. In this, the patient will be sitting on a chair and the therapist will be in front of the patient. Now her arms are placed on the shoulders. The therapist should place her foot on the patient's foot in order to stabilize the patient. Now, while locking the patient's knee with the therapist's knee and by grabbing at the scapular region, the therapist has to slowly take the patient into standing position and then slowly taking the patient into sitting position. The next technique is placing the sound leg on a step. For this, the patient will be in standing position and the therapist will be at the back of the patient, stabilizing the pelvis. By putting weight on the affected leg, the patient slowly has to lift the sound leg and then place it on the step and then take it back. The next technique is placing the sound leg on a step in sideways direction. Following the same procedure as the previous technique, the patient has to place the sound leg on a step in sideways direction.